Hi, so I just wanted to tell you a little bit about my relationship with Dr. Brian and how I got to know him because he's an integral part of this program. And he's been a huge person in my life to teach me a lot about posture. And that's kind of what's drawn me to this program today. I met Brian probably 6 years ago. And we've been referring people back and forth, and along the way he just kind of kept encouraging me to change some certifications that I had and to add some ones that he knew were really good. And along the way he kept teaching me as we were working on patients together. And so he's been a huge part of my learning, and so that's why I've involved him in this program as well. So you'll get to meet him here in a second. So Dr. Brian, as a chiropractor and movement expert, what do you think the most important thing is to prevent injury?
The most important thing, I think that is probably a simplified question to a very big answer, but I think the most important thing to prevent injury is to move well and move more. And what I mean by that is if your body is moving incorrectly, you will create injury, and that's just going to fall into a vicious cycle, and you're going to get worse and worse and worse. So the better you move, the more you move, the less injury you're going to sustain. So if we're going to be sitting like this all day at work, we're going to have some serious issues.
Absolutely. So, second question, why is it important to fix your movement sometimes before you move more? You just said, yes, it's important to move often, but then you also talked about moving better. So then why is it important to fix some of that movement before you start doing more exercise and some more intense movement?
So I think the simple answer to that one would be the fact that we don't want to reinforce the negative. And what I mean by that, if you are moving incorrectly and you continue to move incorrectly, you reinforce that movement, creating injury.
But explain how sitting for 8 hours a day for years on end can make you prone to injury.
Very good question. They actually call sitting the new smoking nowadays. And what that involves is the fact that we are sitting all day, and just seeing us sitting here, I may not have the best posture. Mandy always has good posture. I may not right now, but the problem that we get when sitting all day is you got your hip flexors are very instrumental in low back and movement. They stay in a short, tight position all day. You'll decrease the oxygen to that area. You'll increase scar tissue. That creates poor movement. You also kill the butt muscles basically. They become inhibited. They don't work anymore like they should. That way you try to stand up, you can no longer move like you should. You try to move, you can no longer should. Your core gets dysfunctional, it no longer works. Sitting is absolutely terrible. We have to do it obviously in our society, but there are things that can help prevent problems by sitting all day, which obviously Mandy will address.
So this question's a little bit longer, but sometimes when, you as a chiropractor, I've referred clients to you who start training with me, for instance, and they've been sitting a lot and we've got some of these issues going on. Their butt isn't working, their core is not working. And then we start to address some of those issues, but they still have some issues with pain in the beginning and some scar tissue. And so sometimes it works really good for us to see them together. But, sometimes the body has a little bit of like a fight against that new movement, and then sometimes they feel pain, and then that can be scary to a person. So can you explain a little bit about why that happened?
Sure. So when you begin to move, if you haven't moved in a long time, for one, you obviously will get a little muscle soreness when starting to lift weights or new exercise program. That's just the body kind of repairing and rebuilding itself. However, you will also experience pain because the fact is that you developed a movement pattern that is poor. Your body's going to memorize that, and it's going to want to continue to do that. So you need to reinforce that movement pattern to correct it, to prevent that injury.
So even if somebody has, ergonomic type things, or they do a standing desk, that's not necessarily always enough, and they need to do this at home. So a program like this involves a lot of practice and repetition. Why?
Well, it's quite simple. Sitting all day is a repetitive strain, right? That doesn't happen overnight, it happens over time. The same way when you fix something, you can't just build Rome overnight, it takes some time. So repetition will also fix repetitive strain. That includes increasing your mobility, stretching, etc. on your own, outside of what Mandy gives you or even what I give you. Usually if you see me for those types of issues, you will get homework, you will get practice exercises to do in between. And you have to do those well too. The quote Practice makes perfect. I disagree. Perfect practice makes perfect. So if you're not doing quality exercise or quality stretching that either Mandy or somebody like myself would give you, you're going to fail. So it's important to reinforce those proper movements between.
Right, so 8 weeks, 30 minutes each class in itself is not going to fix you, and but doing this on your own over and over and over is going to help. And for some of you out there who might have some more deeply rooted issues going on, it might take a lot longer, and you might have to see Brian a lot longer as well. So last 2 questions. Why do you think the cubicle cure is something every office should have? And then why is this combined with techniques like standing desks or other ergonomic methods best when used together?
Quite simply, it's a very good program because the fact is there's not much of that around right now. I see a ton of patients every week, every day that have issues and they're like, why do I get it? But they sit at a desk all day or they sit for their job all day. There's nothing to them to explain within their office or their jobs to teach them how to move better, how to do simple things at their desk to correct the problem, which would in turn save you a lot of money by not having to see people like me, which is a good thing, although we'll be there to help you, of course. But if you're not taking care of your body while you're sitting there and you don't know what to do, you're going to keep getting these issues. So to have some instruction on what to do is going to be very valuable for your office.
Perfect. Awesome. Anything else you want to add on this type of program, the pain injury cycle, or anything else that you want to add?
I would just say if you guys could get on this program and spread it around and get people to do this, it will help decrease costs, not just with out of your own pocket, but even in your office. And your work injuries will go down. And that is huge. I do a lot of work right now at lumber poultry in town. Anything we can do to help prevent an injury saves the company a lot of money. And this will help prevent injuries as well. The number one injury cause right now to bring people to a healthcare provider is repetitive strain injuries. All of our work right now is very finite movements. It's sitting down. It's not a lot of movement. We get hurt, we get injured, and people don't know why. This is part of the reason why. So anytime you can add a program like the Cubicle Cure is going to be a very, very beneficial thing to both you and your job, your employers.
Thank you. Thank you. So thanks again for having Dr. Brian here, and hopefully you'll get to see both of us very soon.
Was it really bad?
No, it was fine.
Oh,
Just
was
for future.
Let's just-
Doing the cha-cha-cha.
No, you're just swaying
That-
your chair in
that-
the back.
Like a
5-year-old boy.
7-year-old Aiden.
More intense movement.
Pretty simple answer to that one actually is you don't want to.
Alright.
Dr. or Brian here.
That feels really
Get as
strange.
close
That's
to
how you would
this
tell
as
you
you
talk.
can.
Stick your boobs out.
Seriously. Look
Okay,
at my
you
man
can start
chest.
whenever.
Look at my man chest.